Hey, Scandalized listeners, Charlie and Jackie here with a really exciting announcement.
We're doing our very first live recording of Scandalized at Podfort 2025. We'll be live at the Boise Contemporary Theater on Thursday, March 27th at 4 p.m.
Jackie and I are each going to bring you a fresh scandal and break things down from an expert lens, just like on the show.
We'd love to see our amazing listeners, so bring your friends and come talk scandals with us.
That's Thursday, March 27th at 4 p.m. from the Boise Contemporary Theater. See you then.
From the studios of Boise State Public Radio News, I'm Samantha Wright, filling in for Jim Gaudette. It's Idaho Matters. More than a year ago, we sat down on Idaho Matters to talk about Idaho's 3 biggest health concerns. Those came from a survey conducted by 23 different hospitals, health districts, and other agencies who asked the people who live in 10 counties in western Idaho what they're worried about when it comes to health care. And that group is known as the Western Idaho Community Health Collaborative. And they took those answers and began planning how to try and fix some of those problems. And we wanted to know how the plan is working. That's the focus of a talk at the Osher Lifelong Learning Institute in Boise tomorrow morning. It's called Aligning for Health, Western Idaho Health Implementation Plan. And here to tell us more about this very ambitious project are Charlene Cario, Community Health Manager with Southwest District Health, and Ariel Foster, Senior Benefits Community Health and Wellbeing Coordinator from St. Alphonsus. Welcome to the show.
Hi, Samantha.
Hi, Samantha. Thanks.
Tell us about the Community Health Needs Assessment. Remind us what this was.
So we conduct, every 3 years, we conduct a Community Health Needs Assessment. One, it is a requirement from the IRS for nonprofit health systems, but it also gives the community an opportunity to give us feedback on where we, as a health system, as a health department or public health department, and some of our nonprofits, an opportunity to kind of give us their feedback on where we can lean in and where they may need more support. And then we do that through a survey, our focus groups, our key informant interviews, and then also secondary data like our U.S. Census and other data points that have been published.
Well, and the assessment that we had originally talked about found 3 top health priorities. What are the 3 top health priorities in the community? What are they? What did the assessment find?
Sure. So this Western Idaho Community Health Collaborative Needs Assessment, so done in 2023, the priorities that came out of that data collection were increasing access to care, supporting behavioral health needs, and addressing housing. So those are big topics that have lots of nuance within them. But those are the 3 health priorities driving the work of Western Idaho Community Health Collaborative member organizations, the large health systems here in the Treasure Valley, and the local health departments.
That is a lot of ground to cover. How do you come up with a plan to try and help fix some of these issues? I'm guessing you have to work together and get everybody involved.
Yeah, of course. So that's the value of, I'm going to call it WICHC, because Western Idaho Community Health Collaborative is quite the mouthful.
It is.
So WICHC brings all these partners together to have the same conversation once. So as a collective, we're working to address housing in the context of helping local decision makers increase available housing supply, understand different types of housing availability to support some of those broader needs. In behavioral health, we're working to decrease stigma, ensure effective communication, support the behavioral health workforce. And then access to care is looking to ensure care is provided in culturally responsive ways, that it's available, that it's happening through mobile or telehealth kind of across this Southwest Idaho region. So again, even those are big areas, but being able to do them collectively instead of each organization doing its own thing, we're able to work together, work smarter, not harder, et cetera.
Gotcha. I want to know, you mentioned some of them, but some of the concrete changes that you're trying to make. I remember from the study from last year, behavioral health, the study said that all 10 counties in the region are classified as mental health provider shortage areas, which means we have a lack of mental health providers. How do you address something like that?
Yeah. Well, we're working on it and it's going to take a while. So some of the things that WitchC as a collective are working on is really diving into some more of those workforce needs. What are the challenges with recruiting workforce in those communities? What is possible to address some of those workforce challenges? Is it increasing available training programs, adjusting licensing and certification to still ensure top-notch, highly qualified folks, but kind of making some of those logistical barriers easier? And then doing some of the just-in-time action that we can take now with making sure community members are aware of behavioral health needs, existing support services, making sure those things that already exist are being well utilized to hopefully prevent or divert people from needing higher levels of behavioral health care.
Well, and that's similar to, I think, the limited access to care part of this. And again, the study found that we're not very good at that either. All but one county in the region are considered to be short of primary health care professionals. This has got to be quite an issue. I mean, you're talking about getting more doctors, more counselors, folks who can actually help on the ground. That's tricky.
Yeah, and we do a lot, obviously, as a healthcare system, to recruit and promote our wonderful state, and wanting providers to kind of stay in our area when they get trained. But also we increase access by mobile care units. So St. Alphonsus has a free mobile care unit that targets some of the most low resourced areas in our counties. And then there are other folks within the counties that are also doing the same thing, like Terry Riley and their First Prevention Health. There are several of them out there. And what we want to make sure is that we're all communicating and working together to find and increase access on all areas, not just primary care, but also focusing in on how we can better serve our communities in different ways. So we've been working really hard on getting even just an inventory of what all of our partners in this space are doing, from our immunization partners to our telemedicine partners, all across the board, kind of getting a GIS map even built so that folks can find those community health and mobile healthcare spaces, and then just like the behavioral health, utilize them and have them kind of give a doorway into better access.
I like that idea, a GIS map. And we do that for, everything from biking trails to to all kinds of things.
Security. Yeah, we do it all over the place. And it should definitely happen for our mobile and telemedicine folks as well.
That is awesome. Okay, so what about safe and affordable housing and homelessness? This is a big issue. And as you mentioned, it's not something that's going to happen overnight. But what kind of concrete ideas are you working on there?
Yeah, so we want to educate our partners and collaborators in this space. We want to be a resource, which WitchC wants to be a resource for policymakers, for community members, to anyone who's kind of interested in how housing works even in our area. So we have some resources and funding sources that we're looking into to try to strengthen and help folks understand kind of how housing is done in our communities through our city improvement plans, to talking with policymakers about some of the real issues that require a deeper dive than just we don't have enough inventory in our area to sustain the folks that are moving in. It's a bigger issue, and we want to increase that capacity within our communities.
Right, not just capacity, but the safety of housing, say rental housing. I know that was an issue in the study, and things like that. Even access to being able to live near where you work, for example.
Yeah, so we want to further leverage to and identify all the advocates kind of in our space for housing as well, because there's a lot of us working in that space for sure.
So we've got about 2 minutes left. What are you hopeful so far that you're tackling these issues that we're making a difference after the assessment?
Yeah, I'll say yes. And getting all of the folks to the same table to have those conversations, to coordinate on efforts is, while it seems simple, is no small undertaking. So conversations are happening. Everyone is kind of moving in the same direction. WHC is the convener of this work, which then allows it to be this kind of neutral group having these conversations to then take those into action. And some of that action includes long-term plans. We may never see the fruits of this work for a decade. We know it takes a lot to move the needle in the context of bringing new healthcare providers in, changing local or larger policies. Working with communities is a slow but really impactful and sustainable process. So yes, hopeful, it's coming, and there'll be some little wins and nuggets of implementation along the way. So, Ariel, I don't know if you have anything else to add to.
Yeah, I think, well, for me, I love community voice, and I love interacting with the community about their needs and opportunities. And I think it also gives us an opportunity to see where we're doing well. In this next survey, we could see some differences. I'm not a fortune teller by any means, but I would be shocked if housing, behavioral and health, and access to care wasn't a part of some of the prioritization that we're doing once we get this data back, obviously. So it's a glacier, and it requires patience and time, and it requires passionate folks like Charlene and I who really want to see change in our communities and widespread change that is sustainable.
Wow. We've been speaking with Charlene Carrio, Community Health Manager with Southwest District Health, and Ariel Foster, Senior Benefits Community Health and Wellbeing Coordinator from St. Alphonsus. They're going to be speaking tomorrow at the Osher Lifelong Learning Institute in Boise about Aligning for Health Western Idaho Health Implementation Plan. We'll put a link on our website.
This is the Idaho Matters podcast. I'm Gemma Gaudette.